don't work, but a healthy lifestyle does. Good evening to one and all present here. I am Akshra. Take the privilege in comparing Health Fest 2K22, organized by DORAI Foundation in collaboration with the Department of Nutrition, Food Service Management and Dietetics from Srimati Devkumar Nanala Bhatt Vaishnav College for Women, Crumpet, and Indian Dietetics Association, Chennai chapter. Health Fest 2K22 has organized various scientific talks on nutrition in COVID, ulcers, diabetic mellitus type 1, liver cirrhosis, dengue and malaria, and has enlightened our knowledge in various practices with current medical statuses. Today, we are here to know more about eczema. Eczema? Have you all heard about it? Eczema is caused by the combination of immune system activation, genetics, environmental triggers, and stress. Most of the children outgrow eczema, but for adults, they continue to suffer. Adult eczema is a chronic condition that involves inflamed red, itchy patches of the skin that can erupt oozing flare-ups. A variety of viruses, bacteria, and fungi can cause infected eczema. And to gather more information about eczema, today we have Ms. Jasmine Burley-Lydia ma'am, public health nutritionist, with us. Ms. Jasmine Burley-Lydia ma'am has a strong background in nutrition. Ma'am is well aware of the same in the context of public health and is currently working as a researcher with the ICMR National Institute of Epidemiology. After graduating with a master's degree in Women's Christian College, ma'am has completed a master's in public health from Christian Medical College, Vellore. As a freelance nutritionist in 2017 and a member of the Indian Dietetic Association, ma'am has experience of working in the field of nutrition catering to various clients, help with their needs and nutrition goals. Jasmine ma'am has previously worked at MD Diabetic Hospitals and Tamil Nadu Multi-Specialist Hospital. Ma'am has also certified lecturer in nutrition. Our association is the field of public health with the Tamil Nadu Health National Mission, ICMR National Institute of Research in Tuberculosis, and the International Union of Tuberculosis and Lung Diseases. Ma'am has also a good research experience in writing papers and presenting posters in the area of nutrition, HIV, food insecurity, and tuberculosis. She has been a resource person here at Health Fest organized in recent times. Her keen interest in research has helped in shaping the approach towards our clients towards achieving our goal set. She is a firm believer that a holistic approach, which is sustainable, will provide a better quality of life, meaning to eat is necessity, but to eat intelligently or mindfully is an art. It is an honor and privilege to welcome Ms. Jasmine Burley-Lydia ma'am, our eminent speaker of the day. Over to you, ma'am.
Thank you, Akshara. Thank you for the introduction, and I would like to thank college and the head of the department, Ms. Sarah Priscilla, for giving me this opportunity to be the speaker for today. I'm honored and privileged, and I want to thank each one of you for participating in this session. Let's begin the session. I hope my screen is visible.
Yes, ma'am.
Thank you. So as Akshara was already talking about today's topic, she's already given us a brief introduction as to what is eczema, and today we're going to see about eczema and what can we as nutritionists and dietitians play if a patient with eczema comes to us, or how we can help them out in our area of expertise. So let's begin with some definitions. So first we'll see what eczema is. So eczema can also be called as atopic dermatitis, and to simply explain what eczema is, it is a skin rash which is characterized by an itchy inflammation, and you can see small white and red bumps that itch, and it is often a symptom of allergy. So this chronic inflammatory skin condition usually arises in childhood itself, and in most of the adults, you can see a pattern of flare and remission. So a flare would be if supposing they're eating something or inhaling an allergen, then they can have a flare up of symptoms, which will be rashes or swelling and so many things like that, which we'll be seeing later. So this is how an eczema or a skin rash is usually seen as. On the left side, you can see how it is seen as in children, and on the right
Excuse
side,
me, ma'am.
yes.
Sorry for the interruption, ma'am. The screen is actually.
Is it visible now?
Beryl, yes. Could you please make it full screen, please?
Yes, yes. So I can continue, right? It's visible, right?
Yes, it's visible, but it's not in full screen mode.
Um, for me, it shows as full screen.
Okay. Or shall I ask my student to present? Is that
Just
okay?
now, is it visible?
No, Beryl, it's gone. Yes, it's coming.
Can you see the full screen now?
Yes, perfect. From first slide, please.
Yes. So I was just giving the definition of eczema, which is also known as atopic dermatitis. So eczema is a skin rash, which is usually characterized by itchy inflammation, which appears as small red and white bumps. So this itches, and it can be very painful sometimes. So it is a chronic inflammatory skin condition, and usually it is seen in children and adults. So many times you can see that it arises when a person is in a younger age itself, and then it follows up as flares and remissions. Is when they are inhaling or eating some allergen, something which is allergic to them, then it can produce a pattern of flares. That is, it can the rash can increase, and remission is it can occur multiple times. So, do you think like atopic dermatitis or eczema really has a role to play? Because we have so many diseases which we keep learning about, but yes, it does. So, a very interesting fact was that atopic dermatitis or AD, it is the leading contributor of skin-related disabilities in the world, and the burden is very high among children and women. So as you can see, the developed countries have a high prevalence of atopic dermatitis. For example, in the United States, it is found to be 4.9%, which is 5% of atopic dermatitis conditions, and Japan has around 2%. And in children, it is very high in some countries like Sweden, where you can see 20% of children affected with atopic dermatitis. So this disease, it is very difficult and painful in some cases because it has an impact on the social, academic, occupational, financial aspects of life, and hence it can have an effect on the quality of life of a person. So, what is eczema and what is atopy? So that's what we want to see now. So eczema or atopic dermatitis, as we just saw, it is a chronic inflammatory skin disease. So this is the name of the disease, and many of the families with atopic dermatitis, or sorry, many of the patients with atopic dermatitis will have an history of atopy. So either both the parents will have atopy or one of them. So what is atopy? Atopy is the genetic tendency to develop allergic diseases. So this genetic tendency will develop or showcase as allergic diseases, among which eczema is one of the major diseases. And then we have asthma, food allergy, allergic rhinitis, or hay fever. And this atopy, which is the genetic tendency, is always associated with immune responses in our body. And so these immune responses are very active, especially in cases of allergies. And so when a person inhales something from the environment which is an allergen, or consumes a food which is an allergy, then immediately there is an immune response which can be mild to fatal in some cases. So what is the immunologic basis or the background behind this whole thing? So what happens in our body? Supposing what is the role of our immune system in our body? So our immune system, it functions to clear the body of substances that the body does not need, that like viruses, bacteria, blood cells, and tissues. So normally, when antigens interact with this immune system, they are cleared from the body without an adverse reaction, right? So that's how the immune system usually functions. But in the case of an allergy, it is different. There will be something called as sensitization, which we will look at later. So what happens is that when a person is exposed, or the allergen is exposed to the immune system, for example, a person is having peanut allergies, and that person is exposed, so that person's immune system is exposed to this peanut, the immune system will recognize that as an antigen, or as something that the body does not need, and hence when the person eats peanut, they will immediately have a reaction to it, an allergic reaction to it. So you know that the body produces different cells which to respond to these antigens, like the B lymphocytes, T lymphocytes, and macrophages. So this is the basic immunologic response that the body reacts to or responds to when an allergen or an antigen comes in contact with it. So, what are these heightened immune responses known as here is the Th2 immune responses. And these are responsible for producing a wide range of allergic and inflammatory mediators. So, what are these inflammatory mediators? These inflammatory mediators, they are produced by mast cells, which we will look at later on. And these cells, they release some inflammatory mediators like cytokines, histamine. So when these chemicals are let out by these mast cells, and then immediately there is an allergic reaction. So when you want to treat eczema or whatever therapies are available for eczema, they target these pathways of these immune systems, how they react, to stop the immune system from reacting the way it should. So some of these mediators, um, IgE, which is an allergic antibody, and eosinophils, which is specific white blood cells that play a role in allergic disorders. So I just want you to keep these two terms in mind, which we will learn in detail later on. And when eczema comes here, it is the first step of the atopic march. What that means is that, so this atopic march is this disease, it has a progression. So it refers to the progression of the allergic diseases that begins early in life, and sometimes the patient outgrows it when they become an adult, but sometimes it carries on as an adult. So these atopic dermatitis patients, they often develop other IgE-mediated conditions also, like food allergy, allergic rhinitis, and asthma, which we earlier saw. So how does it happen, or how the skin reacts to it, or how these things take place? So for that, we'll just look at this example of how a healthy skin looks and how an eczema skin looks. Okay, so on the left side we have a healthy skin, and on the right side we have a skin which is showing eczema. So in the center you can see the layers, the hypodermis, the dermis, and the epidermis. So what happens is that you can see inside the circle, you can see some bricks like things aligned on both of these pictures. So on the left side, you can see that the cells are tightly packed, and on the right side, there is a lot of gaps between the cells. So what happens is that when there is a normally functioning protein in the body, the skin cells are held tightly together, uh, like in this green circle. So here you can see that the normally functioning proteins are holding the skin tight together, which allows for a normal skin barrier. On the right side, you can see that when these protein functions are not being normal, or when these genetic factors play a role, then these skin cells are not held together tightly. So what happens as a result of that is that there's a moisture loss, and there is a lot of space between the cells, and hence this moisture loss will lead to dryness, itching, scaling, inflammation, and things like that. So what happens because of this defective barrier, the barrier that is not proper as on the left side, is that irritants and bacteria will enter the surface, or penetrate the surface of the skin, and hence there will be inflammation on the skin, which is exhibited as a rash. So when this happens, many parts of the immune system are activated. So eczema, it can also be called as a disease from the inside out, because of how it is exhibited, how much of immune reactions happen below the surface of the skin to cause reaction outside that we see as a rash or bumps, etc. So before we move on, we have to know like some terms related to food allergies so that we can relate it to eczema. So under this, we have under this adverse food reaction, we have two broad terms. One is food intolerance, and the other is food allergy, which can also be known as hypersensitivity. So what is food intolerance? So food intolerance is when your body is causing an adverse reaction to a food that you're eating. So this can either be because of something toxic in the food, like food poisoning, or some pharmacologic uh, reactions or metabolic reactions, or non-immunoglobulin E, that is the non-cell mediated functions, which reacts to the food or chemical substances in the food. And hence the body is not tolerating what you eat, and hence there is an adverse reaction. On the right side, you see something called as food allergy or hypersensitivity. So this is related to this IgE antibody immune response. So what happens is that when an allergen is supposing eaten or ingested or inhaled by the person, then the IgE mediated reaction occurs when the immune system reacts to a normally harmless food protein that the body has erroneously identified as harmful. What that means is that, so example, somebody who is allergic to, say, egg, which is a protein, which is a food protein, which is a harmless food protein. So their IgE mediated reaction will identify it as something harmful. And so what happens is that there is an immediate reaction to it. So when that reaction happens, there's, say, vomiting or allergies which are expressed because of inhaling that. So these reactions usually occur, you can see them almost instantly or within 2 hours of exposure to the allergen. And sometimes it can be life-threatening. So how does this exposure happen? Exposure can happen either by inhalation For example, if it's pollen allergies, if you inhale, then it is an exposure. Ingest is when you eat something, and skin contact, supposing it gets in contact with your skin. So, and also we must remember that reactions to foods are not limited to only ingestion reactions. What is the pathophysiology behind it? So we already saw how the immune system in our body responds to this, and so these cells which respond to the antigens, the B lymphocytes, the T lymphocytes, and the macrophages. So all these come to play, and these lymphocytes and these T cells, they form the basis for two pathways of the immune system. One is the humoral pathway, and the other is the cell-mediated pathway. So what is the humoral pathway? So the humoral pathway, it involves antibodies, which are also called as immunoglobulins, and it plays a very important role in food allergy. So what happens when an antigen and an antibody come in contact? So the antibody is the immunoglobulin, and the antigen can be the allergen. Okay, so when these two come into contact, there is production of chemical mediators by the mast cells, which will cause symptoms. So there are five antibodies that we know: IgA, IgD, IgE, IgG, and IgM. We are going to look at only the first three because that is our focus for eczema. So IgA, where do you find that? Secretions of IgA is found in the breast milk, and so when an infant is breastfed, they get local intestinal protection against viruses and bacteria. It is also present in saliva and intestinal secretions. So there it blocks the absorption of antigens. What does IgD do is that it is another important indicator for food allergies. And IgE, so IgE is what we'll be looking at majorly because eczema comes under this. And so what IgE antibody does is that it helps to eliminate parasites from the body, and these parasites are responsible for classic allergic reactions which is exhibited in the body. And the second pathway is the cellular or the cell mediated immunity. So this involves the action of T lymphocytes or T cells. So the first pathway is humoral mediated, and humoral pathway involves antibodies or immunoglobulins, and the second pathway is a cellular or cell mediated immunity. It involves the action of T lymphocytes or T cells. So can anyone tell me where the T cells are originating from in our body? T lymphocytes or T cells, where does it originate? Okay, so the lymphocytes, they originate from the stem cells in the bone marrow, and the T cells, they originate from the stem cells in the thymus. So these T cells, they don't produce antibodies like the previous pathway, but they recognize when an antigen enters the body, and they're all similar. They provide resistance against viruses, fungus, tumor cells, and any other foreign cells. And this action is done by the controller lymphocytes, which are Th1 and Th2 cells. So what happens here is when an antigen stimulates a T cell growth, when the T cells produce lymphokines and cytokines, and these can cause direct damage to the target cells, which results in the destruction of antigens or allergens. So IgE antibody is mainly associated with Th2 cells. So this Th2 produces eosinophils and mast cells, and the results of that is atopic disease. So what happens in an IgE mediated pathway is that there is immediate hypersensitivity. So there is an immediate reaction. And then we have IgE and cell mediated hypersensitivity. which where you can see the reaction maybe within 2 hours. And the last one is cell-mediated um, pathophysiology, where there is a delayed hypersensitivity or there is a delayed reaction which is seen. And what are the body organs or the systems that are involved is the gastrointestinal system, the cutaneous, where the skin is involved, which covers our eczema and other respiratory symptoms. So, what is we have been seeing about allergens and reactions and sensitivity and the immune system. So if we combine this whole adverse food reactions, then we can club them into two types, which is immune mediated and non-immune mediated. So under immune mediated, we have IgE mediated, non-IgE mediated, and mixed. So first, under IgE mediated, you can, what is IgE mediated is that all the food allergies will come under this. Example, peanut allergy, shellfish allergy. So here the symptoms are reproducible, and the reaction is immediate. Like I was telling you, it happens from like a few minutes immediately after there is an exposure, and you can see the reaction within minutes or within an hour or two, and not more than that. So you can see under IgE mediated, there is hives, there is swelling, there is oral allergy syndrome, and there is anaphylaxis. So anaphylaxis is the most extreme form, and it can be fatal. And what is oral allergy syndrome? So oral allergy syndrome is something related to pollen allergy. So in Western countries, it is seen that fruits, nuts, and vegetables that resemble pollens in the environment, when it is consumed by a person who has, say, for example, who has oral allergy syndrome, then it will cause a reaction in their mouth. It will cause itching in their mouth. For example, they are consuming the food in its raw form, the fruit in its raw form. For example, if you, but when the food is cooked or heated, then it is tolerated. For example, some people cannot be able to eat apple as a fruit. It can cause an allergic reaction in your mouth, which can be like itching or swelling of the mouth and the tongue. And but they can tolerate, say, for example, a baked apple pie that can be tolerated in comparison to eating the raw fruit. So that is oral allergy syndrome. And next, we move on to the non-IgE mediated or cell mediated. So, as the name says, this is cell mediated, what we have just been seeing before this. So, here we have something called as FPIES. So, FPIES is called as food protein induced enterocolitis syndrome. Here, you will not see any manifestations, like immediate manifestations, like an IgE mediated, like say, for example, hives or rashes or swelling. But here, the symptoms are only gastrointestinal symptoms, and it usually occurs a little late than IgE, say 2 to 4 hours. Supposing IgE occurs from minutes to 2 hours, this will occur, say, 2 to 4 hours. And what are the symptoms that it exhibits is that there will be abdominal pain, there'll be vomiting, which can be profuse, there'll be diarrhea. And also, because of this, there can be dehydration, loss of blood pressure, and hence the person might need IV to replace the fluid loss in his body. And the next is we have celiac disease. So celiac disease, you will all know, I guess. It is not an allergy per se, but what it is that the immune system attacks the intestinal tract among patients who cannot digest wheat or who have no tolerance towards wheat. And next we have allergic proctocolitis. So this is usually seen in infants, especially with cow's milk. So when the infant cannot tolerate cow's milk, then it will result as bloody stools or mucousy stools, and mostly it is usually outgrown by the infant as they grow older, say around 1 year of age. And the third one is mixed. So the mixed one, it can include either IgE or uh, non-IgE mediated reactions. So under that, we have atopic eczema or eczema, and this can be worsened with specific foods. So the next one is eosinophilic esophagitis, which is also known as EOE. So here there is allergic white blood cells, which are eosinophils, which invade different parts of our body, and it can cause heartburn, abdominal pain, and sometimes, if it is very severe, there is a sensation of food getting stuck in the mouth and the food not being able to be swallowed by the person because it usually involves the esophageal tract of the person. And it is usually in rare cases, and it is usually managed with a gastroenterologist. So on the right side, we have non-immune mediated. So under that, we have metabolic, pharmacologic, toxic, and others. So under metabolic, we have lactose intolerance. So lactose intolerance is not an allergy, but it is a enzyme deficiency. So we have this enzyme called lactase in our body, which is responsible for breaking down of sugar and milk, which is called lactose. So when this enzyme is lost, or when this enzyme does not function, or when it is impaired, then a sugar will accumulate in our GI tract and it draws water. So our gut will draw water and it will cause very unpleasant situations like bloating or gassiness and so on. So how do you treat it? You usually ask the patient to avoid dairy products completely, or lactase supplements can be provided to tolerate a few dairy products. And the next one is the ethanol intolerance. So here, similarly as lactase, this is also an enzyme deficiency. So people who use who lose the enzyme or lack the enzyme to break alcohol can have symptoms when alcohol is consumed. The next one is pharmacological pharmacologic, which is caffeine. So here we see caffeine. How it will react is that it is a result of mechanism of the food or drug. That is how the mechanism or its mechanism in the body can cause reactions. For example, caffeine consumed when consumed by some people, it can cause jitteriness and increase the heart rate. And the third one is toxic. So toxic is basically food poisoning. So what is cromboid or other food poisoning is? Cromboid is it is commonly seen when fish is consumed. For example, when spoiled fish is consumed. So it is not an allergic reaction to the fish itself, but it is due to the histamine-like chemicals that are being consumed in the spoiled fish. And the last one is others, where we have anorexia and gustatory rhinitis. So here it includes eating disorders, and gustatory rhinitis is usually seen in older patients when there is a runny nose when eating certain foods. And currently there are nasal sprays which are available, which treats this very well. So these are the adverse food reactions, and this gives us an idea of how diverse uh, the food reactions occur in the body, and how the immune system reacts or responds to it. Now we'll move on to something specific, which is IgE mediated food allergy. So IgE mediated food allergy is what is linked to eczema. So here what we see is that IgE mediated food allergy occurs when people develop allergic antibodies to specific foods. So how the symptoms occur is that when the person eats the specific food or comes into contact with it, then you can see the symptoms appearing within from minutes to hours. So it affects many organ symptoms. So, for example, if you take respiratory, you will have coughing, sneezing, wheezing, and breathing trouble. And when you look at GI symptoms, there's vomiting, diarrhea, and abdominal pain. And then when you look at the skin, you can see hives, swelling, itching, and cardiovascular. You can see low blood pressure. And the oral symptoms will be throat itching, swelling, and throat closing. And anaphylaxis is the severe form of food allergy. On the right side, you can see a picture of hives. So that's how hives appear on the skin. So why is this Ige mediated food allergy very important? It is important because in some countries it is increasing in prevalence, especially among children. So what are the commonly identified allergens? These are the commonly identified allergens: milk, egg, wheat, soy, peanuts, tree nuts, finfish, shellfish, and sometimes sesame is also found to be an allergen. So in children, you will commonly find milk, egg, wheat, and soy. These will be the major allergens. And nut and seafood allergy is usually seen in the adult population. For some people, it is persistent throughout their life, but some people will outgrow this. Next, we're going to look at two terms. What is sensitization and what is an allergy? So, sensitization is the exposure to an antigen or allergen that results in the development of hypersensitivity. So, we saw what hypersensitivity is. So, hypersensitivity refers to food food toxicity or food allergy. So, when an antigen or allergen is exposed, it results in the development of hypersensitivity. So, an exposure to an antigen or allergen causes hypersensitivity. So, that is what we mean by the term hypersensitivity. And this refers to the presence of IgE antibodies against a particular allergen. So, this is how is this diagnosed? Is either a positive skin test or blood test. Then, what is the term allergy? So, allergy is the immune response to a substance to which it has become hypersensitive. So, here an example that we can look at is in the case of food allergens. So, when a food is consumed, it will immediately trigger a reaction. And in the case of environmental allergens, for example, some people are allergic to dogs, and so when they are exposed to the dog, then they may sneeze or cough. So this is how uh, an allergy occurs. So what does this have to do with patients with eczema? Is that patients with eczema produce large amounts of IgE, and hence testing, clinical history, etc., are very important when you diagnose and treat a patient with eczema. Now we're going to see how the sensitization process occurs, and in response to the sensitization process, how an allergic reaction takes place. So as you can see on the right side, this blue arrow indicates sensitization, and on the left side, the green arrow indicates allergic reaction. And in the middle, you can see how it affects the person in the form of how the symptoms are seen in the person. So what happens here is this: when an allergen, supposing the allergen is peanut, so when the allergen combines with an allergen specific IgE, so so when it combines with an IgE, what happens is that it releases chemical mediators like histamine, cytokine, and lipid-derived prostaglandins, interleukins, etc. So where does this chemical mediators come from is this mast cells that you can see on the left side. So these mast cells they play a very important role in inflammatory response, and they are immediately activated when an allergen comes into contact, and they play a very important role in how the immune system responds to bacteria and parasites. So the chemicals that it releases are histamine, heparin, and cytokines. So you can see on the mast cell there are antigens, and peanut allergen, which is similar, that green colored boxes that you see. So when it comes into contact with this allergen specific IgE, then immediately these chemicals are released, which is chemical mediators like the histamine and the cytokines are released, and this causes itching, contraction of smooth muscles, swelling, nausea, hives, cramps, diarrhea, and airway obstruction, arrhythmia, and all of these symptoms. So this is how a sensitization process happens, and sensitization process happens, and immediately there is an allergic reaction. What is anaphylaxis? Anaphylaxis, as we already saw, it is severe or life-threatening. It can be fatal allergic reaction, and it occurs immediately within seconds or minutes of exposure. And the symptoms will either be a skin rash or nausea, vomiting, difficulty in breathing, or shock. So if it is not treated correctly and immediately, then it can cause death. So epinephrine is a commonly used injection to treat anaphylaxis. So coming to our food allergy, what are the risk factors for the development of food allergy? So one could be hereditary, as we saw earlier. While taking the history of a person, you have to find out who has the disease, either the parents or one of the parent. And then we have atopy, which could be another risk factor, and antigen exposure, which is exposure to the food, GI permeability, how the gastrointestinal response is, and the amount of antigen that is presented, that is how much of exposure happens. And the last one is environmental factors, which can be microbial exposure. So before we move on to diagnosis of eczema and how it is treated, let's just look at two terms. What is severe eczema and what is food exacerbated eczema? So severe eczema is persistent or frequently occurring eczema, and it has to be assessed and diagnosed by a healthcare provider. So when you call it a severe eczema is when the person requires frequent prescription for flare-ups or remissions. And in terms of food exacerbated eczema, which is particularly linked to food, so this is ingestion of a specific food that acutely causes flare of eczema. That is, certain foods which can cause flare-up of eczema, and this flare will occur within minutes or hours. And this can either be IgE mediated or non-IgE mediated, and testing may or may not be useful. So the patient can have persistent lesions if the food is eaten chronically. That is, if they don't stop eating the food, then they're going to be having persistent lesions. So this is the difference between severe eczema and food exacerbated eczema. So we'll move on to the diagnosis. So this eczema, as we already saw, it is a complicated disease involving the immune system and the genetics of a person. So no simple test can be used to diagnose food allergy. So eczema is diagnosed, food-related eczema is diagnosed through food allergy tests. So what are the things to remember when you want to diagnose this? You have to identify which food is the suspect, and you need to have proof that it's causing an adverse reaction or a response, which is the symptoms. And then you have to be sure immunologic involvement, and then you have to rule out non-allergic mechanisms before you confirm the diagnosis. And also, it is very important to remember that when there is an improper diagnosis, that can affect the nutritional status of the affected individuals. Because in case of food allergies, you might stop or completely stop a food or some foods. So when there is no proper diagnosis, then the person can have risk of nutritional status being affected. So what are the tools that we use for diagnosis is clinical history, immunologic testing, biochemical testing, skin test, food elimination diet, and food challenge. So first is the clinical history, like how we do for any disease. You get a description of the symptoms and time of food ingestion, which is relative to the onset of symptoms, and description of the most recent reactions. What are the suspected foods? And you also need to estimate the quantity of food that is required to cause a reaction from the clinical history and the family history of atopic disease. Next is a physical examination. So in physical examination for children, you will consider height, weight, head circumference. So, and you will compare their height and weight to the growth charts that we usually do. This is to help to see if the child has malabsorption or malnutrition and also potential food allergies. So when there is clinical signs of malnutrition, then you will evaluate fat and muscle stores also. And also you have to see when you're physically examining, you can also see if there is an evidence of atopic dermatitis or eczema, which is usually presented as itchy rash with red or white bumps that we've earlier seen in the pictures. And also if there is an evidence of allergic rhinitis and asthma. So the first one we saw was taking a clinical history, and this one is physical examination. The third one is the food and symptom diary. So here what we do is that we ask the patient to record, say for 2 weeks, 7 to 14 days, we ask them to maintain a food diary. This is to understand what is the general food reactions with specific symptoms. So this can be used to identify possible nutrient deficiencies also, because we'll know what are the foods the person is avoiding and what are they taking. And and when can we use a 24-hour dietary recall is that when the reactions do not occur frequently. So when you're considering a food and symptom diary, what are the things that you will include? Is time of the food eaten, quantity and how much of the food is eaten, what are the ingredients that go into the food, and when does the symptom happen? Like, for example, when the person is consuming a food, within how many minutes the symptom happens and what are the symptoms that happens, and if they're taking any medications before and after the onset of the symptoms, because these medications can alter the symptoms or the allergic reaction. So it is very important to ask them if they have taken any medications before or after the onset of symptoms. And this food and symptom diary is also very useful when it is non-food allergy. So supposing it is related to pet allergy or the allergies because of food preservatives or food additives, then you can also understand what is happening when you have a detailed food and symptom diary. So this is an example of what are the things to make note of in a food and symptom diary. This is for a week. On the left side, you can see the symptoms, and then you have the breakfast, and then you have snack, supplements, symptoms, lunch, snack, symptoms, dinner, snack, symptoms, and medication. So after every meal and before the meal, you want to make note of the symptoms and what they're eating, what goes into each meal, and if they're taking any medications. The next one is biochemical testing. So this is to rule out non-allergic causes of the symptoms. And here you can either take a complete blood count or stools can be tested for ova and parasites. The next one is immunologic testing. So in immunologic testing, there is something called as radioallergosorbent test, which is a RAS test, and enzyme-linked immunosorbent assay, which is ELISA. So what happens in this RAS test is that it is a blood test where the level of allergy to the antibody or IgE is measured when this allergen mixes with your blood, and you get the percentage or the results of how much reaction occurs. And the other one is the CAP-THEA, which is a fluorescent enzyme immunoassay. This is also a blood test, and this is found to be very accurate in children when you want to identify common food allergens like milk allergies, egg allergies, fish, wheat, and peanut allergies. The next we have skin tests. So under skin tests, this is the most economic and it will provide results within 15 to 30 minutes. But it has a high negative predictive value. What this means is that when you test negative, it is you cannot say that that is not a threat food. And it has a weak positive predictive value. That means that some people, it may show that they have a food allergy towards certain food substance, but in reality, the person may actually be able to tolerate the food and they may be able to eat it without any reactions. So those are the disadvantages of the skin test. And this skin test, how it is done is that it is a prick test. So there is a comparator wheel or the control wheel. So when the wheel is 3 millimeters greater than the negative control, then you get a positive result. And negative skin prick tests have excellent predictive accuracy and suggest the absence of IgE mediated reactions. So how it is done is, so they apply the allergen to the skin, and the next picture you can see that there is um, a comparator to the allergen, and there is a negative allergy skin test. You cannot see any reaction on the skin, and when there is a positive allergy reaction, that is how it appears. And so the skin becomes red and itchy if the person is allergic to a certain food. On the right side, you can see the same test being performed in the back of a person. So in children, also this skin prick test is done for the common allergens, and also for atopic dermatitis, this skin prick test is used. But for children below 2 years of age, even if they get a positive skin test, it has to be confirmed with something called as a food challenge, which will be looking at in a few minutes. So, so for children less than 2 years of age, a skin prick test alone does not give a confirmation. And all foods that test positive must correlate with a strong exposure history to food challenges before they are considered to be allergic. And the next one we have is the food elimination diet. So here, food elimination diet is usually used for chronic symptoms such as hives or angioedema and eczema. And what is a food elimination diet is that you eliminate all forms of cooked, raw, or protein derivatives of the allergen or the suspected food from the diet. And during this phase, a food record is being maintained. So what does this record do is that it helps you to capture all the foods that you have suspected, and also it helps you to evaluate if there is any nutritional adequacy in the diet because of eliminating certain foods. So In case of, say, strict elimination diet for more than 2 weeks, then you have to consider vitamin and mineral supplementation. And whenever possible, the elimination diet should be personalized. And you should always remember that you can only remove one or two suspect foods from the diet of a person for a 2 week period. You cannot remove all the suspected foods at the same time. It is a slow trial and error process. So you can remove only one or two suspected foods at a time. And any food that is suspected or that is eaten more often um, than once in every 4 months can be substituted with an alternative. So you can provide alternative options for certain foods if they are not going to be eaten or consumed regularly. And in case of eosinophilic gastroenteritis or eosinophilic esophagitis, then we go for something called as an elemental diet, which is a severe form of elimination diet. Here, formulas are substituted for foods, and the food is returned to the diet once the person is able to tolerate while being carefully monitored. So in this elimination process, you you help it helps you to understand whether the symptoms are resolved or improved with avoidance of certain foods, and if symptoms still persist, although you have avoided all your suspected foods, then you have to consider what the other causes are, and whenever you get a positive result on a skin test, then and symptoms improve with elimination of the food, then the food can be eliminated from the diet until an oral food challenge is conducted to confirm. So this oral food challenge is a very strong diagnosis which proves or disapproves a food symptom relationship. And if symptoms improve only with elimination of multiple foods, then you will be conducting multiple food challenges to see what is necessary and what is not. So an example of elimination diet is it is of 3 stages. So in the level 1, um, you just want to avoid milk, egg, and wheat free. So those are the foods that you will avoid. And in the level 2, you will go for something stricter. That is foods avoided in level 1, plus anything that is related to non-vegetarian foods or milk or eggs or citrus fruits, tomatoes, and all of this. And in your level 3, what you do is it is a severe form of eliminating the diet where you will only include these foods and everything else will be excluded. So these are the 3 stages where you will try eliminating specific foods from the diet of a person and see how they are responding, how their symptoms are reducing or increasing, and then you will decide what to give them and what not to give them. So the next one is the food challenge. So what we do here is that this food challenge is gives us a very accurate measure or diagnosis if the person has an allergy or not, food related allergy or not. So you can conduct a food challenge only when the symptoms have been resolved and the histamines are and the antihistamines have been stopped. So what is a food challenge is that foods are challenged or foods are given to the person one at a time, whatever the allergy food is. So that is given to the person at a time on different days, thus eliminating the confusion as to what is causing the allergen. So this can be done in 3 types. One is the single blind, where the food is given openly, and the next one is the placebo control, where food is hidden from the patient with at least one placebo. That is, the patient will not know what food is being given to them. And double blind placebo controlled food challenge is the doctor or the health practitioner and the allergist will both not know what food is being given to the patient. And here you can have 1 to 3 placebos. So what what is done in a food challenge is that the allergen or the offending food should be given every 15 to 60 minutes until there is a convincing but not a life-threatening response. And the goal is to ingest 6 to 10 grams of dry food or 80 ml of liquid food, which is mixed in a masking food that the patient tolerates. And the person who's who shows a positive challenge response, you give them appropriate medications to stop the symptoms and then observe them for additional 1 to 2 hours before sending them off. And a person with a negative challenge response, then even though they have a negative response, you still observe them for 1 to 2 hours to see that any reaction or symptom is occurring at a later stage than expected. And then once you're sure that the food is well tolerated and there are no adverse reactions, only then the person can be sent home. So when there is a negative result in the double blind, then you go for an open challenge. So the patient is given a serving of the suspected food and you see if reactions happen in the open challenge. That is, you don't blind the patient or the practitioner from what food you're giving them. And you have to confirm if the reaction is occurring within 2 hours. And if it is a non-Ige mediated reaction, then it can occur even after 24 hours after the challenge. So you have to be specific and you have to be clear before this is done. And you also should have a clear history of the patient, a clear history of the suspected foods. And also this should be done in a controlled environment in the presence of a doctor and an allergist and a nutritionist or whoever's in the team with proper medical equipment to control the adverse symptoms or reactions if it happens. So now we'll move on to who should get tested for a food allergy. So any person with a reliable history of allergic reactions, children who have severe eczema, and although they are being treated, they might be having some allergies like milk, egg, and peanut allergies. So these children have to get tested. And children with history of food allergy to more than one food, which increases the risk of allergy, should also get tested. So how do you prevent food allergy? So we have guidelines in place by the American Association for Pediatrics for Children. So until recently, it has always been advised that you delay the introduction of foods which is causing allergy to children. But in recent years,
So next what we're going to see is the food elimination diet. So the food elimination diet is used for patients who have chronic symptoms such as hives, angioedema and eczema. So what we do here is that all forms of cooked, raw and protein derivatives of the suspected food is eliminated from the diet, or it is removed from the diet. And a food record is maintained when you carry out this elimination diet. So this food record will help you to record all forms of suspected foods that have been eliminated from the diet, and that can be helped in evaluation of the nutritional adequacy of the diet. So this food elimination diet is usually carried out for approximately a week to 2 weeks, which is about 14 days. And one important thing you should remember is that when you're going for a food elimination diet, if the person is going to be eliminating the specific food for more than 2 weeks, then you should consider vitamin and mineral supplementation to avoid nutritional deficiencies. And whenever you plan a food elimination diet, you should remember to keep it personalized, and you can eliminate only 1 or 2 suspected foods maximum for a 2-week period. You cannot eliminate more than 2 suspect foods at a time for the 2-week period. Only 2 is the maximum. And any food that is in the suspect list or which is eaten more often uh, than once in 4 months or so, it can be substituted with an alternative. So you can find out what alternative is available in the market and substitute with that food. And in case of say eosinophilic gastroenteritis or eosinophilic esophagitis, then we go for something called as the elemental diet. So this elemental diet is the most severe form of elimination diet, and here what we do is that formulas are substituted for the actual food, and the food is returned to the diet one at a time when the patient is able to tolerate while being carefully monitored. So the next what we're going to see is the elimination process, how you do it. So here we determine whether the symptoms improve or resolve when the food is avoided, and supposing if the symptoms persist, then although you have, say for example, you have removed egg from the diet because you are suspecting the person to have an allergy to egg, but although you have removed, you still see that the patient has symptoms, then you consider other cases, non-food cases also, non-food allergy cases also, to see if that could be a reason. And if a positive result has shown in the skin test, and along with the positive test you see that the symptoms are improving because of the elimination of the food, then that food should be eliminated from the diet until you can conduct a oral food challenge. So we'll see what an oral food challenge is later, but this is a very authentic test to prove or disapprove a food symptom relationship. So if the food improves only with elimination of multiple foods, then if the symptoms improve only with the elimination of multiple foods, then you have to go for multiple food challenges to confirm this. Next slide. So in the next slide, we're going to see a simple example of how this elimination diet is done. It is done in levels, where in the first level, you first eliminate a few foods and see how the symptoms are for the patient, and then you go to the next level, and then if the patient is still having symptoms, then you go for the most strictest form of the diet. So for example, in level 1, you want to make the diet milk, egg and wheat free. So foods to avoid will be like cow's milk, eggs, wheat, butter, margarines, and all of that which includes milk. So when you go to the level 2, you make it stricter. So all the foods in level 1 will be avoided along with the foods that are shown here. So in the next slide, we see level 3, which is a very severe form. So here, only these foods are included and the rest of the foods are avoided. So this is how an elimination diet is to be planned according to the tolerance and symptoms of the patient. So next we have the food challenge. So the food challenge is conducted once all the symptoms have been resolved and antihistamines are stopped. So this food challenge, what is food challenge? Food challenge is where the foods are challenged one at a time. That is, whatever food you suspect to be the allergen, you challenge the food one at a time on different days. Okay, so this food challenge can take place in 3 ways. One is the single blind. So in the single blind, food is given openly, and in the placebo controlled, food is hidden from the patient. That is, the patient does not know what food they're being given, and it is mixed with a placebo. And in double blind placebo controlled food challenge, the food is hidden from both the patient and the health practitioner, and here we present the patient with 1 to 3 placebos. Next slide. So while this food challenge is being done, what are the things to remember? So in the food challenge, the offending food or the suspected food is given every 15 to 60 minutes until you are convinced that the person is able to tolerate or not tolerate. And the goal here is to ingest 6 to 10 grams of dry food or 80 ml of the liquid food. So this dry or liquid food is mixed in a masking food. So this masking food should be what the patient can tolerate. And what do you do when you get a positive challenge response? That is, supposing a person is eating something and then they have a positive result, that is, they are allergic to that food. So when a person has a positive challenge response, then you give them appropriate medications first to stop the symptoms, and then you observe them for an additional 1 to 2 hours to see if they're having any other symptoms. And what do you do with a person who has a negative challenge response? You observe them also for 1 to 2 hours, because sometimes symptoms may occur at a later time than expected, and the amount of food that is tolerated also should be observed so that the person can go back home and try it out later. Next slide. So in the next slide, what we see is when the negative result is obtained, then you go for a open challenge. So that is, you want to confirm if the patient is really giving you a negative response. And so patient is here again given a serving of the suspected food, and the reactions that are occur after ingesting is noted down. So most of the reactions, if it is IgE related, it will occur within 2 hours of the challenge. And supposing if it is non-IgE related or non-IgE mediated reactions, then it can take more than 24 hours also. We have to be very careful when trying these food challenges, and it should be done under conditions where a doctor is present, you have the appropriate medical equipment necessary, and all the other people who are involved in treating the patient. Next slide. So in the next slide, we see who are the people who have to get tested. So one is anybody with a reliable history of immediate allergic reactions after eating food. They should get tested. And children who have severe eczema, or children who have uncontrolled eczema, that is, they might have been treated multiple times, but they still don't know what is causing it, then they must be assessed for contributing food allergy component. And most of the allergens for children will be milk, egg, or peanuts. And children with a history of food allergy should also be tested. Next slide. So in the next slide, we are going to see what is the prevention of food allergy. So the American Association of Pediatrics has come up with the new guidelines for prevention of food allergy. So for children, it has been advised till recent times to delay the introduction of foods which are causing allergy. But the prevalence of allergy among children in the Western countries has shown to be increasing over the past 10 years. So recent studies like LEAP study, where they learned about early introduction of peanuts to stop peanut allergy, has led to new recommendations and guidelines. So now the AAP guidelines recommends that introducing allergens early in life for children can induce tolerance. Next slide. So what is the treatment for this? The medical management, as we just saw now, includes history, physical examination, food and symptom diaries, biochemical and immunologic testing, food elimination, food challenge, epinephrine for management of acute reactions, and anaphylaxis. And what is the nutrition management? Nutrition management will be avoidance of food allergens and to provide alternative nutrient sources. Next slide. So under treatment, we have something called as the oral immunotherapy, which is a new upcoming treatment. So this is also carried out in children. So in oral immunotherapy, what happens is that in this treatment, food allergic patients consume gradually increasing amounts of the food to increase their threshold for the allergic reactions. So this has been shown to reduce the risk of severe allergic reactions, and this therapy should be carried out only under supervision of a medical practitioner, because there can be a risk of allergic reactions. But patients may still need to practice food allergy avoidance or know how much their body can tolerate. So in the next slide, we will see how this process happens in children. So on day 1, you see that the doctor will first give the child a small dose of the food allergen and watch them for a few hours, and we'll see how they're reacting to it. So in the upcoming 2 weeks, they will dose up the food allergen. So this will go on for about 6 to 9 months. So about every 2 weeks, the doctor will increase the amount of the food allergen until the child reaches a threshold or the maintenance dose. So after this is the maintenance phase, where for months to years, the child will eat that specific amount, that specific measured amount of food allergen as directed by the physician, because now the physician can be able to tell correctly that the child can tolerate that food allergen only up to this amount, because that is the threshold. So this is how an oral immunotherapy process happens. Next slide. So what are the strategies for coping with food allergy? So supposing somebody comes with you with a food allergy, so how can you help them out? What are the strategies that you can give them? Practical solutions. So one is food substitutes. So food substitutes is you try to give them a substitute item for anything that they're asking for, and the substitute item should look like the food allergen. For example, if the whole family is eating ice cream for dessert, then the person with a food allergy who may not be able to process ice cream may get another type of frozen dessert which looks similar to the ice cream, but you can't give them something something totally different like a cookie or something like that. And next is dining out and eating away from home. So when a person is dining out or eating away from home, it is always safe to ask the waiter what ingredients or what are the things that go into making of the food, of a particular food, and also be aware of your allergies and decide on what food you can tolerate and what food you can't based on proper information that you receive. And next is grocery shopping. So while going for grocery shopping, you always have to make a list of foods that are safe to you. But even though you make a list of foods that are safe to you, it is always better to read the labels, the nutrition labels or the ingredients labels that is given at the back of the food packet to understand what are the ingredients they are using. And sometimes these ingredients can change with new products, so it is always good to read the label before you buy a product in case you have food allergens. And a use of substitutions in cooking. So supposing a person can't eat egg, they are allergic towards egg, then you can encourage making eggless cakes or recipes which don't require using egg. And supposing if they can't tolerate wheat, then you can give them wheat flour replacements, or tips for cooking without wheat, use some other flour where wheat is not present. So these are some of the practical strategies that we can suggest a person who has food allergy. So to conclude, we have to understand that eczema is a complicated disease involving both genetic and environmental allergens, and we have to exercise patience while helping out a patient with eczema, because it is going to be a trial and error method, and the patient is going to slowly try out different foods, and then you're going to be able to understand which food is causing the reaction and how you can resolve it. So it's going to take time and patience and effort. So it's always good to exercise patience with the client and also encourage them to try out different options. And the most important thing to remember is that while eliminating foods or food groups, there's always a nutritional risk, and this has to be well taken care of when you go in for this trial and error methods for more than 2 weeks.
Curiosity is the fuel for discovery, inquiry, and learning. Ma'am, shall we have a question and answer session? Participants, you can drop your questions in the chat box. Ma'am, I have 2 questions. Which group of the people is more likely to develop atopic dermatitis, ma'am?
So the first question is, which group of people are more likely to develop atopic dermatitis? So this would be children who have a family history of food allergies or who have a family history of atopy, and also children whose parents have asthma and allergies. So these are the people who usually are prone to develop atopic dermatitis. And also it is said that women and children are seem to have a higher prevalence compared to the other group.
Ma'am, how was atopic eczema diagnosed, ma'am?
So the next question is, how is eczema or atopic dermatitis diagnosed? So it is usually diagnosed by a medical practitioner, say a dermatologist. So they will examine the patient and they will look for signs and symptoms, and they will diagnose and confirm if the person has eczema.
Ma'am, and we have a question in the chat box. What does FPIEC mean for?
The next question is, what is the full form of FPIES? So FPIES stand for Food Protein Induced Enterocolitis Syndrome. And what happens here is that you will only see gastrointestinal manifestation. You won't see hives or swelling as it happens in IgE reactions. And this is a disease or a condition where you will see the reactions happening after 2 to 4 hours of eating the food, and the symptoms that are seen is abdominal pain, profuse vomiting, diarrhea, and sometimes BP can also drop because of fluid loss, and some patients may also need IV to replace the fluid loss.
Thank you, ma'am, for answering the questions patiently and for giving us an elaborate informative talk. You have enlightened us about anaphylaxis, food allergies, food challenges, OIT, and food elimination diet. Gratitude is when memory is stored in the heart and not in the mind. On behalf of DORAI Foundation and from Department of Nutrition, Food Service Management and Dietetics, Srimati Devkunar Nanalabad Vaishnav College for Women, Crumpet, I express my sincere thanks to our speaker of the evening, Ms. Jasmine Burnley Lydia. Thank you, ma'am, for sharing your valuable time with us. Thank all the spectators for your presence, and last but not the least, I thank the technical team for the support. Dear participants, stay tuned with us to connect with the next interesting scientific talk in nutrition in urinary tract infection by Ms. Sujata, registered dietitian, on 22nd January 2022. Don't miss to explore fun-filled quiz activity on today's topic, nutrition and eczema, tomorrow at 6:30 p.m. Once again, I thank one and all present here. This is DORAI Foundation and Team NFSMD signing off. Stay safe, take care.